Hey everyone, welcome back to another episode of the Untrivial Podcast. My name is Allie Nelson. I'm so excited about today's episode because this has to be one of my favorite conversations that I've recorded. As you all know, I am pregnant. I am now 31 weeks pregnant, which is just at the beginning of the 8th month mark. So we are nearing the end, which is super exciting. I am feeling scared and excited and nervous and all of the things that you could possibly feel right now. But I am also kind of in that prep mode and trying to just learn everything I can, prepare everything I can before baby gets here. And my guest today is Doctor Kaitlyn Kakar. She is a physical therapist with 10 years of clinical experience whose goal is to empower women with the knowledge they need to thrive during pregnancy and postpartum. Her aim is to give women the resources and support to not just survive motherhood, but thrive. Today we discuss what exactly the pelvic floor is, its function, changes to the pelvic floor during pregnancy and childbirth, how to rehab the pelvic floor post-birth, and so much more. I really enjoyed this conversation, especially as a pregnant woman who is someone who didn't really know where to begin with understanding this side to birth prep and recovery. If you are someone who is thinking of pregnancy in the future, or you're currently pregnant, or you're already a mother, or you're a partner to any of the above, this episode is packed with tons of really great information. I have linked all of Kaitlyn's socials and her website in the show notes, and you can connect with her at thriving.mamas, MOMMAS, on Instagram for more details. And now, let's get into the episode. Kaitlyn Kakar, welcome to the Untrivial Podcast. How are you doing today?
I'm doing great, thank you.
Amazing. I am so grateful to have you here. You are a pelvic floor specialist, and I feel like this is something that so many women hear about, don't really know what it's all about, but it is super important. And so I'm so excited to dig in with you today, all things pelvic floor and pelvic floor health, especially as women are moving through pregnancy and postpartum and those big transitions with their bodies. So thank you so much for being here. I guess we could start with what is your professional background and how did you get into this space?
Sure. So I've been a physical therapist for almost 10 years, and I started out in outpatient orthopedics. So I saw low back pain, neck pain, post-surgical cases, kind of anything that you can think of that relates to orthopedics. Then my husband and I moved to Sydney, Australia for his job. So I became a physio over there. And I worked at a clinic that was right down the block from the beach, so an ideal location. And I ended up treating and seeing a lot of pregnant and postpartum moms. And another physio who was in the clinic with me was specialized in more of the pelvic floor health side of things. And I learned so many things from her. So in school, we had maybe one lecture on pelvic floor, and I remember sitting in class being like, I'm never going to need to know this information. I never want to treat this. So it all kind of went in one ear and out the other. But once I got in the clinic, I started realizing, like, oh my goodness, there is such a need for this. It is a fascinating area of our body that so many women don't know anything about until they have issues, whether that's leaking, whether they become pregnant, whether it's through birth, whether it's postpartum. So then fast forward, my husband and I got pregnant. I ended up having our daughter over there and then going through the whole pregnancy and postpartum period as well. I was able to experience firsthand just the lack of information and education and knowledge about this area of our body. So then once we moved back to the US in when did we move? Let's see. My daughter was born in March 2020, so COVID times. So we ended up moving back in July. And I just felt this passion of like, I need to do this. I need to specialize in pelvic floor health. I need to treat pregnant and postpartum moms. I never thought I was going to start my own business. Luckily, my husband has all of the business education and knowledge that I needed to get this business going. But I ended up starting my social media account because I figured this is the easiest way that I'm going to be able to educate people the quickest way possible. And then I discovered I really enjoyed that. I loved educating moms about these things. I felt like I had this secret that I just had to share with everybody. So just trying to get out all this information or things that I struggled with that I found would be helpful, things postpartum that happened. So then started offering virtual appointments, and eventually that has now transitioned to a full-time in-person practice. But something that I love is still the education piece. So I'm so happy to be on this podcast to be able to hopefully share with your listeners what the pelvic floor is, what are the purposes of it, what happens during pregnancy and postpartum, all of that vital information. But all the courses that I have taken for pelvic health has been in addition to all the physical therapy education that we have. So, for most people who are specializing in pelvic floor physical therapy, you can also be an occupational therapist, but it is additional coursework that we need to take in order to be able to treat this part of your body and to be able to do some internal techniques and internal exams as well.
Gotcha. No, that's amazing. And it sounds great to have like that foundation of physical therapy and then this added specialization on top for this really specific part of the body. So
Exactly.
I'm so excited to get into that. So let's start with the basics. Let's do a 101 here. What
Okay.
is the pelvic floor?
Okay, so for those of you who can see me, I'm going to show you on my pelvic floor model. Otherwise, if you're just listening, I'll give you very specific instructions of where these pelvic floor muscles are. So, if you can imagine your pelvis, and if you put your hands on your hip bones, those are the two sides of your pelvis, the bony parts. Those two parts meet in the front at your pubic bone. So, if you feel where your belly button is and you walk your fingers down to the first bone that you feel down south, that's your pubic bone. So the front part of the pelvic floor muscles attach into that pubic bone. Those muscles go all the way back to the tailbone, which I feel like most people know where your tailbone is, right in the back, kind of right at
Hmm.
the top of your butt crack. And then on both sides of your sit bones. And those are the bony bits that ideally we should be sitting on. So everything on the bottom part of the pelvis, those are your pelvic floor muscles. Your pelvic floor is not just one muscle, it's a group of muscles, and there are three layers to those muscles. So the outermost layer makes a diamond shape around those points that we talked about. So your pubic bone, your sit bones, and your tailbone. The second layer going deeper, or you can think further up towards your head, go around the openings. So the openings being the urethra where the urine comes out, and that's the one almost closest to your pubic bone, the vaginal opening where the babies come out, and then the anal opening that's in the back. And then the third layer, and I'm taking out the internal organs, so your bowel, your bladder, your uterus that sit in that pelvic bowl, that's where the third layer lives. So it's the deepest layer up the highest towards your head. So these muscles also have some important functions. So, one I kind of alluded to is it helps to maintain continence, meaning it keeps things in that we don't want to come out, meaning urine, stool. So it's preventing the leaking of those continents. The second thing that it does is it aids in sexual function. The third thing is that pelvic floor is the base of our core system. And when I talk about our core system, I'm talking about the diaphragm, which sits up underneath your ribs. That's your breathing muscle. Your abdominal muscles that go around the center, your spinal muscles in the back, and then we've got the pelvic floor at the bottom. So these muscles can really help give our body a lot of stability if they're working properly. If they are not working properly, this is when we can start to have dysfunction that could even look like back pain or hip pain if those muscles at the bottom aren't stabilizing properly. So, those are kind of the main functions of what the pelvic floor does. So, bowel, bladder, sexual function, and then giving us that really good stability.
That was such a good run through. I feel like I already know so much more than I did because I honestly had no idea. It's like you hear all about this. I think more so when you get into this age or timeline of maybe trying to conceive or you're pregnant. But before then, I haven't heard about that at all. And like I don't even
Right.
think they really teach it.
I don't think they do either. And the funniest question that I feel like I get all the time is like, does my husband have a pelvic floor? Do men have
Yeah.
pelvic floor?
Do they?
Everybody has a pelvic floor. It looks a little different. Obviously, the parts are a little different, but we all have pelvic floors. And I wish this was taught to us at a young age. So, like for my two daughters, I have a 4-year-old and a 2-year-old. We've already talked about anatomical parts. And as they start to get
Mhm.
into puberty and have their periods, I want this to be common knowledge. So, when something doesn't go as planned or normally, that we're able to get help as soon as possible.
Mhm. So you mentioned that it obviously is keeping things in. What does it do as it relates to sexual function? You mentioned that component as well.
Yep. So with sexual function, if you are, having penis into vaginal intercourse, this is the area that we're going to be sensitizing. Okay. And of course, we have the clitoris up at the top here. So, in order to achieve an orgasm, those muscles, they kind of go through rapid contractions. So, sometimes if we're not able to achieve orgasm, or if sex is painful, we're going to look at the pelvic floor muscles to see why that might be happening. So, fast forward to the postpartum period. With the change of hormones that can happen, a lot of times those tissues will become very dry because of estrogen levels being low, which could be a reason that sex is painful postpartum. But a lot of times, what I'll see is there is tension or tightness in these muscles. And I think there's some myths that we need our pelvic floor muscles to be tight. Tightness is not necessarily a good thing. Our muscles need to have the appropriate length, strength, coordination, endurance, just like any other muscles in our body. So imagine if your biceps muscle were tight all the time. You'd kind of be walking around with your arm like this. And for those of you who can't see me, I'm bringing my hand towards my shoulder. I'm shortening that bicep muscle, and I'm not going to be able to reach out and grab something or use that functionally. The same thing with those pelvic floor muscles. If those muscles are too tight, you can think they're almost in more of a closed down state. So when something is trying to go in there, if those pelvic floor muscles can't relax, that's going to be painful. That's going to be uncomfortable. So those muscles can be like that I was describing, very closed down and tight. But we can also have tightness in any of those layers that I talked about at the beginning, or on one side or the other. So if you're sitting there and you have experienced pain with sex, this can also happen, not even related to pregnancy and postpartum. Some people just have some dysfunction in those pelvic floor muscles, but I'm here to tell you a pelvic floor physical therapist can help address these things as well.
That's great to hear. No, that's super helpful. So, I guess why is it that the pelvic floor becomes so much more of a topic of conversation once you get to pregnancy?
Great question. So let's talk about what happens to your pelvic floor during pregnancy. So now I want you to imagine your pelvic floor kind of like a sling or a hammock. Okay. So we talked about how it holds all those nice organs in. So you can imagine inside their uterus where that baby is growing, things are going to eventually start growing and getting bigger. So there's going to be an extra added weight down on those pelvic floor muscles. So now those pelvic floor muscles need to work much harder than they probably have ever had to work before because of this extra added weight on these muscles. And you can kind of think a similar thing is also happening with your abdominal muscles, but though that's something that we can visually see. Your belly starts to grow, those abdominal muscles start to stretch, which is a normal part of pregnancy. We want those abdominal muscles to stretch, but those pelvic floor muscles are being affected in the same way. So for someone who, those muscles start to get that extra load and weight, if those muscles aren't functioning optimally, meaning they're not strong enough, there's some weakness in there, there's too much tension, they're not coordinated, this can start to look like leaking when you cough, leaking when you sneeze. This could also look like pain in your pelvic floor, like by your vaginal opening. It could be pain up by that pubic bone. It could even be pain in your back, pain in your hips. So, a lot of these aches and pains that we can experience during pregnancy, it drives me crazy, but I hear from patients, "Oh, my OB just told me, like, you're pregnant. You're going to experience these things."
Mhm.
Instead of just sending you to see somebody that can help make it better, like a pelvic floor PT. But a lot of those things are related to the pelvic floor and the changes that happen in those muscles as you get further along in your pregnancy. Not every person will experience pelvic floor dysfunction. So, not every mom will have leaking when they're pregnant. Not everybody will have pain. And I wish I could predict who will have it and who won't have it, but we can kind of look, what has your history been like prior to pregnancy that might give us an indication of the state of your pelvic floor. So if you're one of those people who feel like you have to pee all the time, you're peeing every hour, you can't hold your bladder, you leak a little bit when you laugh, those pain with sex, that's another one. Those are indications that there's something that we need to address with the pelvic floor. There's either a strength issue, there's a tension issue, there's some underlying things going on with your pelvic floor that we want to try to address, ideally prior to pregnancy. But if not, as those muscles have that added load and stress, those issues are going to start revealing themselves a little bit more, so that then those are some things that we'll want to address.
Mm,
And then I would love to share about birth and what the pelvic floor role is with birth, and a little bit about postpartum. Can we chat about that?
of course.
Okay, perfect. So during birth, another myth that I hear a lot is, I need a strong pelvic floor to be able to push this baby out. That is not true. Our pelvic floor muscles need to get out of the way. They need to lengthen, they need to open, and they need to relax in order to allow the baby to pass through. Our uterus is the muscle that is contracting to help push the baby out. So, we do need appropriate strength during pregnancy to keep our pelvic floor strong so we're not leaking and having all those aches and pains that we were talking about. But we also need the appropriate length and to know how to relax these muscles. And that's a really key thing that we do in pelvic floor physical therapy during pregnancy, is teaching your body how to let go and to relax those muscles. Majority of the patients that I see have tension and tightness in their pelvic floor. So they can turn the muscles on, but they can't quite let go or relax or feel what that sensation feels like. And it's hard because I can't see those muscles. I mean, I can look with a mirror and get some feedback. But like when you're doing squats, you can see I'm bending my knees and I'm extending my knees. I can see my quads turning on. It's so much easier to get that brain body connection versus when I'm
Right.
trying to turn on these muscles that are internal, it's kind of hard to feel. So it's a big thing to be able to know what it feels like for those muscles to relax and let go. And then the other thing that the pelvic floor muscles can do, that lengthening, is what happens when you're pushing. And so sometimes you'll hear you want to push like you're pooping, but that's not where the baby's going to come out of. They're going to come out of the vaginal opening. So you want to push more like you're pushing a tampon out. And so that
Mm,
sensation is also kind of hard to feel and wrap your head around. Okay, I'm going to inhale and I'm going to exhale, and I want to try to push down and I want to try to push out. But we really need those relaxation of the muscles to be able to get the baby out. Then, once we fast forward postpartum, if we had a vaginal delivery, these muscles have some trauma to them. So they stretch almost 7 times their length to allow the baby to come out. So oftentimes we need to think of what happens to our pelvic floor more of like an injury. And that's how we want to start recovering. So for some people postpartum, those muscles kind of tighten up to try to protect and to try to heal. So postpartum, oftentimes we are left with some residual tension and tightness that we still need to relax and release and let go. I think oftentimes we think, oh, a baby came out of there. Everything is just loose and opened and relaxed. And for some people, that does happen. But also for a good majority, things are tight. And now we need
mm,
to tell those muscles how to turn on again. How can I start contracting them again? Just like we need to turn on our abdominal muscles and we need to rehab those muscles and get those muscles strong again, the same thing needs to happen with those pelvic floor muscles in that postpartum period as well.
okay. So I think, yeah, I think there's a lot of myths around that because I think a lot of people's assumption, myself included, is, oh, I need to strengthen this pelvic floor in advance of birth, i.e., make it tighter, stronger, all those things. No
Mhm.
one really talks about relaxing it. And then I very much just had that same assumption of like, okay, afterwards I gotta, tighten it back up again. But you're
Uh-huh.
saying it's
Uh-huh.
the opposite again. So that's so interesting. Um, do a lot of women get referred to pelvic floor specialists when they're pregnant? Or I feel like it's not talked about even during pregnancy. I think the way that I've found out about it a lot is through social media or through podcasts and just like learning online. But I don't know if it's super ingrained into like the medical system when it comes to birth. Have you found that?
100%. I would say most moms find me through Instagram, through word of mouth. I speak at moms groups. And I always wonder, like, why aren't more people getting referred to us? And I think it's twofold. I think part of it is pelvic floor PT as a profession hasn't done a great job of marketing to the OBs and telling the midwives what exactly we do. So I think a lot of times it's not that they're resistant to refer to us. I just don't think they know how we can help. Or for a lot of the older providers, I mean, pelvic floor physical therapy is kind of new in the grand scheme of things. So if you're an older provider, you kind of are doing the things that you know how to do, and your job is
Right.
to make sure that mom and baby are healthy through pregnancy and birth. And then afterwards, it's kind of like, all right, all done. These are just normal things that you're going to experience. But now we know that there are things that can help. And so a lot of times after I see a mom, I will be like, please go back to your provider and tell them how important this is, how helpful it is. Tell all your mom friends so that more people can know about PT, this specific type of PT, and how we can help. And so I'm seeing a change here in Arizona, and there's a few specific midwives that I work with who do send majority of their patients my way during pregnancy, postpartum. I'm just starting to get some OBs doing the same thing, but it's hard to get in to see an OB. I mean, as a patient, it's hard to get in. So to be able to educate them, it's tough. So I feel like I'm kind of going in the back door of like using my patients to then try to educate the OBs and midwives and
Mm-hmm.
how we can help. And I see it being more of a collaborative approach. Like I want to help their patients have a better pregnancy and hopefully a better birth experience to recover better postpartum. So I think it can very much be a collaboration of sorts, but I think it's just going to continue taking time before it's like this is just an automatic referral of things that happen. When I was in Australia, though, I feel like it was more of an automatic thing that happened. Like it was discussed in our prenatal appointments. If you're having these issues, this is a provider that could help. Or after the 6 week appointment, after I saw the OB, they highly recommended seeing a pelvic floor PT because the assessments that your OB or midwife is doing postpartum is looking very much from a medical standpoint. Have incisions healed? Has tearing healed? Has your uterus shrunk down in size? Are there any confections that we need to be concerned about? A little bit about your mental health. That's what they're looking at. So that is the clearance that they are giving you. But our clearance that we're giving you, we're going to assess the pelvic floor muscles from a functional standpoint. Do they have the strength? Are all three layers turning on the way that they need to? Are the right side, the left side, the top, and the bottom turning on the way that they need to? Do they have endurance? Are they coordinating? Is there any pain in that area? How is the scar tissue moving if you did have any perineal tears? That's going to give us an indication of when you are ready to go back to sex, is it going to be painful or is it going to feel okay? Looking at that pelvic floor in a very specific way is going to give you a better indication of how things are going to feel. And I can tell you, a majority of my patients, myself included, we're not ready to get back to sex at 6 weeks postpartum. So, for all those listening, it's not a rush to get back. Your body might not be ready. You're also going to be sleep deprived, trying to keep a newborn baby alive. So, take into considerations all those things and also educate your partner on these things too. They assume, like, great, we get the clearance from your doctor, let's do it, without realizing all these things that your body has just gone through. So, if we as women don't even know what happens to our body, our poor partners are just assuming, yay, 6 weeks, we get to go. But it's like, wait a minute, let's talk about all these things that my body has just gone through, just so we are all educated on the same things that are happening.
Yeah. Oh my gosh. Yeah. And like, even just mentally, you might not be ready, and that's okay. That is like not very
Exactly.
much time past probably the most, I don't like to use this word, but it is like a very traumatic thing for your body to go through.
It
It's a beautiful
is.
thing, it's amazing, but like
Yeah.
you are in recovery. Like, oh my goodness. Yeah.
Totally. And that's why I've started again, I don't want to think of birth, yeah, as a trauma or negative or an injury or anything like that because it is. It's a beautiful experience. You're bringing a baby into the world. It's incredible. But thinking of it more from like an anatomical, physiological perspective, those muscles do sustain injuries and we need to be able
Mhm.
to recover from those injuries. And I think it does set us up for more success though when we think about birth like that. So when it gets to 6 weeks, we're not like, oh, I should be way further along, or I should have bounced back by now, or I should be able to return to my spin class or my hit class. But if we think of it, if you sprained your ankle 6 weeks ago, are you going to be going on a 3 mile run? Probably not. You're going to go through that rehab process to make sure you have the range of motion and strength and you can hop on that foot before you go back to the run. So I think if we can reframe what that postpartum recovery period is going to look like, hopefully all of our expectations are also going to be managed a little bit better for the recovery isn't going to be just 6 weeks. It might be 6 months. It might be 9 months. It might be 12 months, it might be 2 years. Like my youngest just she'll be turning 2 in June, and I feel like I am still recovering from birth and pregnancy and gaining my strength back. And that should be more of a norm versus, "Oh, you're not better at 6 weeks? What's wrong?" Nothing's wrong. Your body's still recovering.
Yeah, absolutely. I want to talk a little bit about the pregnancy phase, and then I want to talk about the childbirth and postpartum phase. But okay, so during the pregnancy phase, if you are pregnant, when is the optimal time to start seeing a pelvic floor specialist? And what would you do? Like, what do those exercises look like? Or how do you
Mhm.
know how you're faring from a pelvic floor
Uh-huh.
perspective?
I love it. So I would say if you know nothing about your pelvic floor, if you also would like to be more proactive, start in your first trimester. So I think we experience a lot of things in that first trimester anyway. We might be really nauseous, we might be really sick, we might not want to do anything. But if we can get in that sometime in that first trimester, again, you don't have to come as soon as you find out that you're pregnant, maybe 10 to 12 weeks or so, but we can do a lot of education of what to expect. What is pregnancy going to look like? What sort of exercise do you currently do? What do you enjoy doing? Exercise is a key component to pregnancy. I see so many moms who are scared to exercise during pregnancy. You hear a lot of mixed information about what you can and can't do during pregnancy, but we're doing a disservice to the mom if we're stopping all exercise. You can kind of think as pregnancy is like you're training for this marathon that is birth and all these changes we've been talking that our body has gone through. We need the strength in our muscles to be able to support these changes. So, a lot of times it will be like, what exercise are we currently doing? What do we ideally want to be able to continue to do? And what are these changes that our body is going to go through to help support you to be able to do these things? So, some key things that we'll talk about are certain areas of our body that we know tend to get more vulnerable, say like our low back and hip. That's something super common that we see a lot during pregnancy when it comes to aches and pains. We need to make sure that those abdominal muscles are turning on properly. So when you're in that first trimester, you might not be showing a whole lot, so you can still feel what it feels like to turn on those muscles. And a lot of times when we talk about turning on these muscles, we'll think, okay, I'm going to flex my six pack. I'm going to turn it on. I'm going to kind of hold my breath and flex the muscles. Versus what I try to teach is we want to get all the core muscles to turn on. So when we're trying to turn on those muscles, ideally we want to feel the deepest muscles turn on. And so one of those muscles is called your transverse abdominis. And this muscle goes from the back where your spine is all the way around to the front. And it literally acts like a corset. It's a stabilizing muscle. So when we try to turn this muscle on, if you don't quite have that baby bump yet, what it's going to feel like is that you're trying to pull your two hip bones together. You're trying to draw those abdominal muscles in. So it feels more of like a wrapping and a drawing in sensation versus a flexing. As you get further on in your pregnancy, you can think of now I want to try to hug that belly bump up and in. And that's going to be those abdominal muscles. I feel like by now everyone has seen those videos where a mom will like suck her belly bump up and in, and like you
Yeah.
can't even tell that she's pregnant anymore. So that's the transverse abdominis. We don't all need to be doing that all the time, but that is the sensation of that drawing in, that lifting of the belly bump up and in. Those are your deep core muscles. We need those to be turning on throughout all of pregnancy to help give your hips and pelvis that really good stability. So it can be as simple as putting your hands on your belly bump, taking a nice inhale down, exhale, trying to lift that belly bump up and in. That can be an exercise. Do that 10 times a day. Great. Then we can try to do that same thing on hands and knees and feel the belly relax down towards the floor. And then exhale and try to pull that belly bump up and in. This was one of my favorite exercises to do, even in the third trimester when you don't feel like doing much of anything. You're still getting that muscle to turn on and activate. So that's kind of the abs side of things. And we'll talk a lot about too about diastasis recti. There's still, I feel like, a lot of unknown information and fear surrounding what is this. So it's the separation of the abdominal muscles. And again, it's a normal part of pregnancy. Those muscles have to be able to separate in order to accommodate the baby. And what's actually happening is there's connective tissue between those two muscle bellies that is thinning and lengthening, allowing that
Mhm.
space. Nothing is tearing, nothing is breaking, nothing is opening. It is just the adaptation that our body is going through. So we can talk about how do we minimize the severity of diastasis recti. And so this will be as, you continue to grow and the belly bump starts getting bigger, we need to be more mindful of how we're moving. So instead of getting out of bed doing a sit up to get up, roll over to your side, use your arms and legs, push yourself up so that you're not using your abdominal muscles as much and straining through that area. Or if you're laying reclined on the couch, use your arms to try to push yourself up using the arms more so than we're using those abdominal muscles. So it'll be a lot of, answering the questions about that. What if I'm seeing this? Then what do I do? We'll talk through like what core exercises are you already doing? And when might you need to modify that? And so this could look like something of when you're doing your core exercises, say you're used to doing, some crunches, we want to look at their abdominal muscles and see what's happening. So if we're seeing coning or doming, and what that means is the abdominal muscles will look like they're almost coming up and out to a point, making kind of a cone, and that's a sign that there is increased pressure going into that area. And if we see this once or twice, no big deal. It's going to happen, but it's a sign that that is where a lot of the pressure is going. So if we can change how we're breathing and really focusing on exhaling, that might make that coning go away altogether. Great. Keep doing that exercise. Or you might try to think, okay, I'm pulling those hip bones together as I'm doing the exercise. If the coning goes away, great. Keep doing the exercise. But then you might notice week upon week, maybe when you get into your second trimester, every time I try to do crunches, I'm just seeing that coning. That might not be the best exercise to do. Then we might go and transition more of to those belly hugs that we were talking about before. So I know I just chatted a lot about the abdominal muscles, but some other key muscle groups are your hips. We got to have really good hip stability. And this could look like exercises like squats, like lunges, like bridges. We don't need to do a ton of fancy exercises during pregnancy, but we really need to target these key muscle groups to help keep the strength. Then we'll talk about some mobility. So, a lot of times we'll get neck pain or upper back pain. Our posture starts to change. The shoulders roll forward, your head might come forward. You might just feel like you're more hunched over because there is added weight on the front side. So, we'll talk about how can we stretch our pecs? Can we do a doorway pec stretch? Can we lay on our back for a few minutes with our arms open and stretched if that still feels comfortable? We'll talk about getting a lot of rotation through your upper back, doing an exercise called an open book where you're rotating through your top half, or doing a thread the needle from on hands and knees. So it really is kind of a head to toe approach of what are some preventative things that we can start doing early on. And then we'll kind of keep tabs throughout your pregnancy. But if you're not having a lot of leaking, heaviness, pain, I might not see you until middle or end of your second trimester. If you feel like you know what to do, your body's feeling good, things are going well, great. I might not need to see you until that point. if you're having a lot of aches and pains, then I'm going to want to see you more consistently so we can address those things so you can feel good. And then getting into the third trimester, we start to talk about, all right, if you're the type of person who really likes to lift heavy and go hard in the gym, what is that third trimester going to look like? How can we start to decrease the weight as your body increases in weight? So you're still going to get a lot of load, but the mindset starts to shift to that birth prep. We need to start relaxing and opening, doing some hip openers, doing some things to help relax the pelvic floor. We want to make sure that that hip joint has enough movement in both directions to allow the baby to be easily able to pass through. So around 34, 35 weeks is when we really start to dive into the birth prep side of things. What are hip exercises we can do, hip openers? Is there anything related to the pelvic floor that we need to address to relax and release? There are some pelvic floor PTs who will do internal massage and techniques during pregnancy. It's my personal choice that I've decided not to do that. There's plenty of external things that we can do, in my opinion, to still be able to connect and release those muscles. We start talking about perineal massage, and this is something that we can do starting at 34, 35 weeks to help massage and relax and stretch those muscles of the pelvic floor. There's some research that shows that that helps to decrease the grade 3 and 4 perineal tears or the more severe tears, which is great to do if we can minimize that. We'll talk about laboring positions, how to push, what positions can you be in to push, how to breathe when you're pushing. Do you want an epidural? Do you want an unmedicated birth? So, things a little bit different than what you would get in a birth course. We're going to look at it more from a pelvic floor pelvis standpoint and how can we support your body in that way. And then I love to have an appointment, usually around 37 or 38 weeks, that talk about those first 6 weeks postpartum, kind of what to expect. What are good things that we can start doing? We need to rest. That's a huge one. I think most people try to jump back into things, especially if they're feeling really good. But again, we need to have that rest period. So I love the 5-5-5 rule. You want to stay on your bed, in your bed for 5 days, on your bed for 5 days, around your bed for 5 days. So we are slowly over those 15 days starting to do a little bit more. But in that first week, just rest, lay down, snuggle with your baby, feed your baby. It's a big emphasis on the resting, but that's also going to allow your pelvic floor to have that time to heal and start recovering so there's not that excess pressure. And we've talked a ton about a vaginal delivery, but we can now talk about a cesarean delivery. Your pelvic floor is still affected just from pregnancy. So
I was just gonna ask.
even if you have a C-section, your pelvic floor has still been affected through pregnancy. So you could hypothetically still have leaking, you could still have pain with sex, you can still have pelvic floor issues, even though your baby has come out a different way. But we still want to have that really good rest period. And then a few things will change. So recognizing that your body has just gone through major abdominal surgery. And so in that postpartum period, your doctor will probably give you some restrictions, such as trying not to lift more than your baby, being very mindful of how you're getting out of bed. Sometimes it's helpful to have that additional support around your abdomen because of that incision. Things that generally you're not told is how to start desensitizing that tissue. So when we have that C-section, a lot of muscles are cut through, tissue is cut through, nerves are affected. So that area becomes really sensitized, sometimes painful, sometimes numb. So in the first 2 to 3 weeks, we can start gently just touching that area around the incision. So maybe up by your belly button, maybe down a little bit by your pubic bone. If your fingers feel even too painful, taking a really soft material like a cotton ball or a makeup brush and just trying to feel kind of moving those materials along your abdomen will start to help desensitize those tissues and those nerve endings to get normal sensation back. And you want to work from really gentle materials up to a little bit more rougher materials so that when you're wearing underwear, pants, leggings, it doesn't feel uncomfortable or painful or really sensitized. We want those tissues to get used to having that sensation on there without
Mhm.
your brain being like, this is painful, this is uncomfortable. And that's what the desensitization does. And then as you get further along, we can start massaging some of the tissue and making sure there's not excess scar tissue so that area is able to move. And ideally, you're going to go in to see a pelvic floor PT around 4 to 6 weeks postpartum. And that's generally when I'll recommend my patients coming in. But we'll kind of walk you through what those next steps are of how do we need to massage this? What do we need to do to best help that area recover? And in those first 6 weeks, again, if you're having a lot of issues, pain, you can't control your bladder at all, you're leaking stool, if you're concerned at all, reach out. I offer virtual appointments, and I know a lot of pelvic floor PTs do. Sometimes we just need the reassurance of, yep, this is kind of a normal part of the healing process. This is what you should expect. These are some ways that you can help that healing process along. But I find that it's reassuring to have someone there with you going through this versus like, okay, I'm just going to wait it out 6 weeks until I see my doctor. Then we can start addressing some of these issues. Having that touch point, I feel like can be really, really helpful. So, rest is key. We'll talk a lot about icing down on those pelvic floor muscles, icing along that incision, how to pee, how to poop so we're not aggravating that area using the peri bottle. So, we'll talk a lot about the healing side of things. And then we'll also talk about what are good exercises that you can start doing in the first 6 weeks. So, are you going to go back to a run? No, but can we do some diaphragmatic breathing to start get your diaphragm moving again? Can we do some gentle abdominal activation? Can we do some gentle Kegling in those first few weeks? Yeah, we want those muscles to turn on again. We want to, as you're going about your day to day and caring for your baby, we need that core system to start turning on again. So they're not crazy exercises. I think most people don't even consider them exercises. They think of it more of like breath work, but those are the
Right.
things that are good to start doing. Or, if you're having a lot of neck pain, can we do some of those pec stretches? Can we get some rotation through our upper body? I see a lot of moms who are scared to do anything in the first 6 weeks, but not doing anything in the first 6 weeks, we're just kind of getting weaker. Those muscles aren't getting activated. Things get tight, things get painful. So I feel like it's all about knowing that right balance of what can we do to help to support your body, but what is going to be some things that might overdo it. So walking is another thing in that first week, just walk around your house. Don't, try to go on a walk to the park. Like, still, we're healing. Even in the first 3 weeks, I usually recommend not walking further than a mile. So maybe a few blocks at the most. Maybe you do a short walk in the morning or a short walk in the evening. It's wonderful to get outside for your mental health, but we need to still recognize that a lot of internal healing is still happening. And I feel like that's another reason why it's so hard is externally we might feel good, we might look good, you'll probably still have a little bit of a belly bump, but we can't see all that really important internal healing that's happening. And that's what we need to try to keep in mind as we're going on these walks or even when we're baby wearing. Some moms will have a lot of heaviness and pressure down in those pelvic floor muscles when they're baby wearing because it is an added pressure, it is an added weight. And I love baby wearing, but if you're feeling a lot of those symptoms, maybe do it in, smaller segments. Maybe do it for 10 minutes at a time as opposed to putting your baby and carrying them around all day on you. So just
Mhm.
kind of tuning in and listening to what your body is telling you. And if things aren't normal for you, that's when I would reach out. So I will say there is some normalcy to not being able to hold your pee in the first week. Or if you try to turn on those muscles, you might be like, I'm trying to tell them to turn on, but I don't feel anything down there. That's normal. Your body just went through birth. It will take some time for those muscles to turn on and for you to be able to hold your bladder and for you not to be able to leak. But if we're getting into weeks 3 and 4 and you're still experiencing those same things, reach out. There's something that we'll need to address for why that is still happening. And it should be things are steadily getting better over those 6 weeks, not they're staying the same or getting worse. That would be another time that I'd reach out if you feel like things are just getting worse or they're not getting any better.
Thank you so much for walking through that. That was so thorough, and I feel like I just did a crash course in understanding my body. I just want to recap quickly just to make sure I've understood kind of the timeline of it. So early pregnancy, it's totally okay to strengthen that pelvic floor, do lots of exercises. Late pregnancy, we're a little bit more focused on relaxing, mobility, opening. Early postpartum, we are resting. Don't do a lot for those first couple of days, weeks, but then pretty soon after, we're trying to re-engage and not wait too long to get back into the groove and start tightening those muscles again. Is that
Exactly.
okay?
Perfect. That was a great
Amazing.
summary. Yes.
No, I love it, and it's so helpful because I'm currently 7 months pregnant, so I'm like a little bit later in the
Yay.
journey.
Uh-huh.
Yeah, but I definitely feel like I can't get out of bed the same way. Like normally you could just use your abdominals to get out of bed. No, I need to
Totally.
roll. I'm like using arms, and yeah, it is such a strange experience, but it's good to know that there's such a process that people can follow, and there's so much information
Mhm.
out there that we can utilize. One thing I did want to ask about, and thank you so much for addressing kind of both vaginal births and cesarean births, because they are different, but pelvic floor matters in both cases. When it comes to people who do experience prolapse or damage or trouble with their pelvic floor afterwards, what are like the stats around that? Is it super common? Is it rare? Like how many people do you know are affected by pelvic floor issues following any sort of birth?
Yeah, so I looked up some of the most up-to-date stats for you, so I'm gonna read some of those off. So it is estimated that up to 66% of women will have incontinence during pregnancy. Okay.
Wow.
47% will have some degree of incontinence after birth. And for prolapse, up to 50% of women will have some degree of prolapse after birth. And then 1 in 3 women will experience pelvic floor dysfunction in their lifetime. So I would say it's
Wow.
pretty darn common that people are going to experience
Yeah.
some things.
How would you define the difference between pelvic floor troubles versus prolapse?
hmm So prolapse, you can think of it, it's a specific diagnosis. And so what does that mean? I think they're similar to diastasis recti. There's a lot of fear around it. And what is it? And you Google things and you see organs are falling out of your body. And I want to dispel some myths too and ease some fears. So we can think about it again, similarly to the abdominal muscles. And I keep referring back to the abs because we can see them, we can see the changes that are happening and it doesn't become as unknown. So, just like those abdominal muscles stretch and that tissue that I was talking about is being lengthened and stretching, things are more mobile in that area. Similarly, it's happening down in your pelvic floor. So, your bowel, your bladder, and your uterus are, of course, being supported by those pelvic floor muscles in the bottom. And then there's ligaments that are suspending those organs to the sides of your body, so to speak, just to make things simple.
Okay.
So, the ligaments, which are also around all the joints in your body, become looser during pregnancy. That relaxin hormones allows things to move so your pelvis can open up to allow the baby to pass through. So there is some degree of movement of those organs during pregnancy. Then we have that added weight. And then we potentially have some issues of the pelvic floor, that added weight and some weakness. So those organs can sit a little lower in that vaginal canal. So if we think of our bowel, our bladder, and our uterus kind of like in a line, okay, so the bladder is going to be more in the front, our uterus is in the middle, and then our bowel is on the back end. Any of those can sit lower than their quote unquote normal position. And that would be some prolapsing or a descent of one of those organs. So you can think just from being pregnant, from birth, it kind of makes sense that there might be some movement of those organs. And then there's, of course, varying degrees. So it goes from a grade 1, which would just be a little bit of descent, all the way to a grade 4, which would be coming out of your body. And those grade 1 and grade 2 are the most common. So symptoms that you might be experiencing to know if you have prolapse would be heaviness, pressure, feeling like there's something in the vaginal opening. People will sometimes describe it as I feel like I have a tampon in there, but I don't actually have a tampon in there. Sometimes feeling like you can't completely empty your bladder or you can't completely poop all the way. Sometimes those will be symptoms that might give us a clue that there might be some degree of prolapse going on. The good news is pelvic floor PT is really, really helpful for those grade 1 and 2. There's research that show it can decrease by a grade, but a big thing that we'll work on is try to minimize those symptoms. So we want our bodies to not sense this heaviness and pressure all of the time. So this might look like we're teaching you how to breathe appropriately so that we can manage the pressure above the system a lot better. So there isn't as much pressure down on those organs. Or a lot of times we'll talk about pooping habits. So constipation, if you are constipated, it's going to be taking up space in that pelvic cavity that can make you feel like you have excess heaviness because there's excess stool there. So, making sure that you're staying regular can be something huge to help with these symptoms. In addition to getting your hips strong again, getting your abdominal muscles strong again, giving the body the good support that it needs so these organs don't feel like they're sitting quite as low. So, even if you experience prolapse, if you've been diagnosed as prolapse, surgery isn't your only option. There's a lot of things that we can do to help address the symptoms, to help improve the things that you're feeling. But I just feel like when you Google prolapse, all that you're seeing are these scary pictures, or you're going to need surgery.
Yeah, absolutely. No, it does sound very scary. And obviously, this is not meant to incite fear into
Right.
anybody. It's really just to bring awareness. And can't believe how common some of these issues are. And, if not prolapse, but just pelvic floor injury
Yeah.
following birth.
Yeah.
Like, it's something we should all really be aware of and pay attention to.
Totally.
And yeah.
Totally. And I can speak to personal experience. So I had prolapse after both of my kids. I think maybe a grade 1, maybe a grade 2. And so the symptoms that I was feeling is just that little bit of heaviness down in my pelvic floor. So as a pelvic floor PT, I knew what the symptoms were. But for me, I wasn't scared of it. I thought of it as just like some abdominal separation. I also had a 3 finger width abdominal separation, and I know it's part of birth. I think sometimes when we hear these things, we get scared and then we get stressed and then the symptoms get worse. Our brain is so powerful over our body, and especially there's a big
Mm-hmm.
nervous system component to our pelvic floor. So if we're nervous and stressed about it, our pelvic floor muscles are also tightening up when we need them to be able to relax and let go. So, just kind of trying to put things into perspective, realizing that you're not alone in this. I experienced it. I'm still doing all the things I want to do. I can still run, I can still lift, I can still jump. So, also realizing it doesn't mean that you're not going to do anything ever again. It's just we want to systematically rehab and recover and make sure we're giving your body the tools that it needs to feel the best.
Yeah, absolutely. I'm still like blown away that probably before the last, what is it, 10 or 15 years, that so many women may have been going through this and not had the resources and not had the education. And that's just so unfortunate to think about and know. But I'm so glad there are people like you out there who are educating and teaching women all about this, because it really can impact their quality of life. It can impact their birth. It can impact their recovery. Like, it's so, so important.
Definitely. And I'll add one more thing. So
Yeah.
for those people who, are 5, 10 years postpartum who are experiencing these symptoms, it's never too late. It's never too late to address your C-section incision and massage it. It's never too late to address the leaking. It's never too late to address the prolapse. So if you are, further on down the line and are like, "Ooh, I never did pelvic floor PT and I'm still having these issues," there's still hope. We can still make changes. So also realize that we can still make changes even though if it's further out. So just wanted to put that out there. So if you're sitting there and you're like, "Ooh, I feel like I kind of missed the boat," you didn't. I see moms 10, 20 years down the line experiencing these symptoms, and we can still make changes.
That's so great to hear. I love that. One thing you always hear, or I think if women hear about pelvic floor, they hear about Kegels,
Yes.
is that the exercise of choice, or like what are women doing at home? Say they're in that post 6 weeks or post 8 weeks postpartum period. What sorts of things are they doing? Is Kegels the number one, or are we talking more like those lunges and squats and things like that?
Yeah. So I feel like let's talk about what a Kegel is first. So I feel like people hear Kegeling and they're like, I don't really know what it is. So a Kegel is a pelvic floor muscle contraction. And so what that involves is you should ideally be able to turn on all the pelvic floor muscles, the front part, the back part. We should be able to squeeze and lift those muscles. So you can think of it, the sensations of what you're going to be feeling when you're trying to Kegel is you're trying to stop from urinating, stopping the stream of urine, stopping from passing gas. So that's going to get the front part and the back part. And then you want to be able to feel a lift up and in. Okay. The other way that you can think of this is squeezing a blueberry and lifting a blueberry up into your vagina. Okay. So that is what a Kegel is. It is a squeeze, it is a lift. I can
Okay.
tell you majority of the patients that I see who I do an internal exam to assess this are not doing Kegels correctly. They are either not getting a full squeeze, they are squeezing but not lifting. They're only turning on either the back part and not the front part. They think they're squeezing and lifting, but they're actually bearing down. So there are a good majority of women who are just not doing Kegels correctly. So it's kind of like telling people, oh, we should just do squats, but never showing someone like how to do a squat. Like, what are the correct form? What is the right way to do a squat? I am a very specific person when it comes to exercise. Like, I like form to be to a T so that we're targeting the right muscles in the right way and we're making sure that what you're doing is effective and efficient. So, to not do Kegels properly, it's not worth to do them. Okay. So, I will just put that out there. A Kegel is a good thing to see if your body can do it. Do you feel any squeezing down in these muscles? And if you're like, I don't really feel much of anything, we still can't assume that there's weakness. Sometimes it's just they're not coordinating well. So then we need to work on how to coordinate those muscles with your breathing. Okay. So Kegels would definitely not be my like, every mom should be doing 50 Kegels a day. What I do like to recommend though is we talked a little bit about that diaphragmatic breathing, trying to turn on the pelvic floor muscles. So I do like as you're doing some of the breath work, can we squeeze and lift? And maybe doing 10 of those a day. Are we feeling muscles down there working? Are we feeling muscles turning on? And ideally, we do. We want to feel some sensations. We want to feel some squeezing. We want to feel some lifting. But there's research that's showing we get more pelvic floor activation with things like bridges, like lunging, like squatting, than we do just doing a Kegel alone. So when we
Mm.
think of our bodies, our pelvic floor needs to work into conjunction with our breath, with our abs, and with our lower body. We need everything to work together. And so, ideally, when we're just squeezing and kegeling, we're just targeting those pelvic floor muscles. We ideally want them to be functional. We want them to turn on when we're doing a squat, when we're jumping, when we're going on a run. And this doesn't mean I'm kegeling the whole time I am running. Your pelvic floor muscles should be automated to turn on when they need to, kind of like your abs. So, if we're just sitting here having a conversation, my abs aren't turning on as hard as they can. They might turn on a little bit as I talk, or if I go to stand up, they might turn on and then they shut off again. The same thing with your pelvic floor. When we're at rest, there should be a little bit of resting tone, but they're not clenched, holding on for dear life. And as I'm running and I hit the ground with every stride, there should be some muscle activation that turns on. We're not kegeling the whole time, but we're training those muscles for how they need to work when you do decide to go for a run.
Hmm.
Also goes back to my point of we need to rehab and recover the core and the pelvic floor so that automation is happening before we get into running, impact, jumping, those sorts of things down the line. So, a very long winded answer for Kegels are not necessarily the answer. So then what the heck do we do? So I do like simple things like a glute bridge. So lifting your hips up, trying to feel those glutes turn on, trying to feel your abs turn on, doing little mini squats. So maybe you're squatting down to your couch and then standing back up. Maybe you're squatting at the wall, doing a little mini lunge. So standing in a split stance and just going down a fourth of the way and then coming back up, keeping your pelvis nice and level. I'm a big proponent too on timing your breathing with your movement. So if we take a squat, for example, inhaling as you go down, exhaling as you coming back up. Inhale down, exhale up. We want to feel that engagement on the exhale. We want to feel that lift. We want to feel our abs turning on. We want to do that during an exhale. And so when we're timing our breathing with our movement, we're retraining our core system of how it's working together again. So besides just a squat for the sake of squatting, we're breathing. We're paying attention to our breath. We're trying to feel these muscles working again to try to get everything more automated as we continue progressing our exercises from there. So I don't want to overcomplicate things when it comes to exercising postpartum, but think about the basic movements. What do we do every day? We go from sit to stand, we do a squat, we lunge down to pick up a car seat, we bridge to come up. Those are great things to do. If you want to throw in some upper body exercises, great. We need arm strength as moms. There's so much holding and carrying and
Mhm.
rocking that we're doing that we need upper body strength. And so during pregnancy, I'll talk a lot about strengthening the scapular muscles in the back, doing things like little band pull apart. So putting a band between your hands, pulling that band apart, trying to pinch those shoulder blades together, straightening your arms out in front of you and pulling that band apart, squeezing those shoulder blades down together, lat pull downs, but really working on your upper back strength to help with the posture and a support for all the carrying and the lifting and the things that we're doing postpartum as well. And again, there's millions of programs out there for recovering postpartum. My recommendation is always see a PT first, learn the basics, learn the breath, learn how to turn on your abs, learn how to turn on your pelvic floor, get those things recovering first, then follow some of those great programs that are out there so that I'm activating my abs the right way to make them stronger versus I don't know if I'm doing this right. Am I turning on the right muscle? Am I making things better? Am I maybe making things worse? Ideally, see a PT first, then follow whatever program you want to follow.
That's so great. And I think that's such a great approach of just slow and steady, baby steps, bit by bit. You're on that healing journey. You can't deadlift 100 pounds day one after you give birth, and that's okay. And it can start with these kind of small, just breath work type exercises, and eventually you can work your way up to that. So I so appreciate that. As we wrap up here, I have two final questions for you. So the first is, if you could leave listeners with your message, what you would want people to take away from this conversation, what would that be?
I think it would be see a pelvic floor PT. As simple as that sounds, I just feel like there's so much information that we can give you to empower you. We've talked a lot about pregnancy and postpartum, but kind of any phase of life. And there are virtual options, there are in-person options. I know sometimes cost can be an issue. Oftentimes, I will tell people just do one appointment, one assessment, see where you're at, get some of the information, and then maybe we'll see you down the line when you need help again. So, traditionally, physical therapy has been, we see our PT 2 to 3 times a week for 4 to 6 weeks. I find that pelvic floor therapy is different. So, on average, I might see you every 2 weeks. Maybe I'd see you every month. Maybe I'll see you every 6 weeks. So, finding a PT who's going to work with your schedule, work with the things that you're looking for, we can kind of rethink what physical therapy is. A lot of us take a very holistic approach and we talk about sleep, nutrition, hydration, but get that information from the source, from a reliable source who went through a lot of freaking schooling to do what we do versus I'm just going to follow this mom influencer who's telling me these things to do. So, of course, I as a PT am going to tell you to go see a pelvic floor PT, but I do. I want you to do it. I've never had a mom who hasn't felt the information is helpful, didn't find it beneficial. Most people are like, why aren't more people talking about this? I wish I would have come in sooner. So, if there was a way that I could get all this information out to everybody, that is the goal. There's pelvic floor PTs making courses on birth prep, courses on postpartum recovery, putting together workout plans. So, more information is being put out there. The other caveat to that will be whoever you're following, whoever you're watching, look at their credentials. Are they PTs? Are they OTs? Do they have pelvic floor additional courses? If they're a personal trainer, do they work with pre and postnatal moms? Like those are the things that you're looking for, that the education is matching the information that they're giving you to know that you're looking at reliable information.
Yeah, absolutely. And I feel like that's so true. I feel like we just barely scratched the surface of all the things I'm sure you could dig into. And we talked for an hour, and this was so
Yeah.
helpful and so much. And I so appreciate you. My final question: where can people get connected to you, find your resources, find more information?
Yep. So Instagram is where I am most active. So I'm at thriving.mamas, MOMMAS. And that's where I post a lot of information, a lot of highlights. Please send me DMs. I love connecting with everybody through there. I'm happy to answer any sorts of questions. Like I said, I offer virtual appointments to pretty much anybody worldwide. They are virtual wellness consults. They're not physical therapy services. So I can only provide physical therapy services in the state of Arizona. So if you are in Arizona, specifically Scottsdale and Phoenix, I treat in person. My website has some additional resources and blog posts, and that's thrivingmamas.com. Feel free to send me an email, hello@thrivingmamas.com. I do have a pregnancy and postpartum 4-week workout guide that is on my website as well, if you're interested in that. And these just give some really basic exercises. A lot of the things that we talked about, you can use it in addition to other exercises that you're doing. It can be a standalone program. It's minimal equipment, 20 to 30 minutes, 3 days a week. There's an upper body, a lower body, and a full body component, but it really targets all these areas that we talked about: the core strength, the hip strength, the upper back mobility, things that I see a lot in my practice. And I've tried to compile it into a simple program for you. But I'd say Instagram is probably the best place to reach me.
Amazing. And I will make sure I link all of those handles, websites, and resources in the show notes. Kaitlyn, thank you so much. This was such an amazing conversation.
Thank you so much for having me. I could probably talk about this for 5 hours. So, again, I'm happy to answer any questions that any of you all have.
Thank you so much.